I'd like to introduce Dr. Bob Ghelfi from Sacramento, and he's going to talk to us about more than bioidentical hormone therapy. Please help me welcome Dr. Bob Ghelfi.
I'm a general surgeon, so I'm kind of the odd man out in this group a little bit. I still have a general surgery practice. I'm still pretty much full-time in both. Can you hear me okay? Closer? Okay. I have a general surgery practice, and I started BodyLogic in Sacramento, BodyLogicMD in Sacramento 3 years ago. I have to tell the story because I met Patrick before I'd even taken a course. I really started thinking about changing the way I looked at the business of medicine. I am the odd man, and I like business too. I was doing my MBA at the time, and I sat down with Patrick, and he got his little computer out, and he said, if you open the practice, on this day you'll have this many patients, on this year you'll have this many patients, on year 2 you'll need an associate, and he went down the whole thing. And I said, yeah, and we did it anyway, and thinking he was right on every single number that he told me about. My girlfriend, now wife, and I decided that we wanted to do something different, kind of out of the mainstream of surgery, out of the mainstream of insurance medicine, and look at medicine a little bit differently too. And it has really offered that in spades for us. We work 8 days a month in our BodyLogic practice, and we have over 500 patients. There's no way we would have gotten any patients without BodyLogicMD. All of the marketing, all of the attracting of patients, and a lot of the keeping of patients is done where we never have to think about it at all. Not only that, but it's a really, really fun practice for us. So you guys are any of you in regular insurance medicine still? Most, at least half. I'm in both, and I can tell you that one's a lot better than the other. And also liking business, when someone writes you a check for something or you swipe a card, our billing department is a credit card swiper, it turns out. And my billing department in my other practice is about 3 people that have to go first ask permission if I can take someone's gallbladder out. And it's irritating. You sit down with the patient, you say, I think you need to have your gallbladder out. And then you have to go ask someone who probably just barely graduated from high school whether it's okay that you do that. Well, we don't do that in this practice. We look them right in the eye. We say, this is what I recommend. This is why I recommend it. These are the expectations you should have, and we'll see you again in 3 months, et cetera. It's far more fulfilling. Surgery is fulfilling for those half an hour or 45 minutes when you're operating, and after that, it's not that fulfilling anymore. But without BodyLogicMD, I can guarantee I would have never thought about doing it. I could guarantee there's no way I could be successful. And any of you who are thinking about doing it on your own, unless you have the talents of probably 30 or 40 people that work in Boca Raton, I would not even think about it. It would just be too much work. In addition, I've really enjoyed adding the things that I've enjoyed adding to the practice. I've really gotten involved and interested in the nutritional aspects for our patients. It segued into my other practice too. I mean, I can't tell you how many gallbladders I haven't taken out that in the old days they'd have been out in a week, but they didn't need their gallbladder out, it turns out. And so we spend a lot of time and enjoy taking care of people's nutritional problems. Going through diet plans. We do detoxing on probably at least half to 3/4 of our patients on their initial visit. We talk about fitness. One of the things that I was really interested in was the whole fitness aspect of it. So no one leaves the office without a fitness plan, and we enjoy seeing them kind of run a half marathon or building up to a 5K. And the other thing that I've really enjoyed is I've enjoyed pellet therapy. I would say maybe 3/4, Patrick, of the people do pellets, maybe more, maybe close to 100. Everybody's trained in pellet therapy. It's a really important part of most of our practice. It's a huge part of our practice. It gives me something to cut on. It gets that itch out of my system, and the patients really like it. And it's actually really been important for our ability to kind of keep patients And so BodyLogicMD has really encouraged that to the point where really everybody is trained in pellet therapy who's a BodyLogicMD doctor. Not everybody runs to it, but I think as time has gone on, more and more people are running toward it. I would say it's become something that's really important to our businesses. At any rate, I'm a very, very happy BodyLogicMD doctor. I don't know when I'm going to make the final jump and get away from surgery. I think this last election made it a little closer for me. But anyway, that's all I really had to say, and thank you.
Thank you so much, Dr. Bob. That was awesome.